Welcome back to New Jersey Perspective. I'm Monica Malpass. We want to switch gears a little bit, talk about a very important topic, global health issues, especially in developing countries like Guatemala that are struggling financially and struggling for other reasons health-wise, because a lot of times people are not ready to run to a doctor's office. It's not close by, number one. They don't know that they trust the system, number two. Natural methods of medicine are more accepted because that's what's worked for generations for them. So a local group from Princeton, New Jersey is bringing that to the forefront and making it a reality in Guatemala. We want to welcome Dr. Cunningham, the founder and CEO of Naturopathic Medicine for Global Health, and one of his volunteers, Jeanette Hur, who's been helping in the Guatemalan effort. And let's start with you, Doctor. Why Guatemala? There are so many places, obviously, that are desperate for help. I find it interesting that you picked this particular country. So tell us how that came about.
Well, we were looking for a country that would be more acceptable, and the utilization of naturopathic medicine would be widely used. So in kind of looking around, we did some needs assessments. We took a look at Central America, and we had looked at some other countries, but Guatemala seemed to be the country that had the most utilization of naturopathic medicine, as well as a very large indigenous Mayan population that uses the medicine. So there's this combination of Mayan medicine and what we call here in the United States and Canada, naturopathic medicine.
So it's heritage-based for them.
Exactly.
It came more naturally to go a more natural way. I'm speaking sort of in more generic terms for our audience, but tell me again, what is naturopathic medicine for people who are the untrained in the medical world?
So naturopathic medicine is a distinct form of primary care medicine, utilizing modalities such as homeopathy, botanical medicine, physical medicine, or manipulative medicine that would be something similar to chiropractic, for example. Chinese medicine is often included in that, and whole foods nutrition, and just another way of looking at how the body can heal itself.
So it's more about home visits and building a clinic, which we'll see in just a moment, less about big massive hospitals that are far away from many of the villagers, and more about sort of plants, herbs, acupuncture, natural means of healing. Is that correct?
Exactly.
Okay, so let's talk about, as we look at part of the video of you visiting Guatemala, this is a brand new organization, only 3.5, 4 years old, and we're going to take a look at you while you're in Guatemala. What are some of the challenges for the people there? What are their health needs and issues?
Well, basically it's due to, one, just a large sense of lack of resources. There's a very substantial national healthcare system, but it's very underfunded and under-resourced. So many people who come into the clinic, you'll see that may be the first time they've ever seen a doctor. So a lot of the conditions are very far advanced at some point. And
are we talking measles or?
We're talking intestinal parasites, upper respiratory tract infections, skin diseases, all types of diseases that we would consider almost textbook here. So when the medical students are visiting there, they can actually see cases that they would never see in the United States, and they have an opportunity to see them there.
Jeanette, that has to be such an eye-opening experience and life-altering, really, in so many ways, to see people who have been, through their own need, denied medical care, in essence, their entire lives, maybe 50, 60, 70-year-old people walking in. Are they distrustful because they've never been to a doctor? Are they afraid? Or are they so urgently in need that they would take, you know, pretty much whatever's given at that moment?
When we first encountered them, they seemed very kind of reserved and cautious. A lot of the folks, when we came into town, they were kind of like peering out their windows, looking at us. We were working on the buildings and refurbishing the building that was granted for the purpose of clinical use. And by the second and third day, they had all come out and they understood why we were there. They're really welcoming. They're desperate for care, so it's not even a matter of they're denied, it's just that there isn't anything available, right? So whatever they can get, they'll be willing to accept. And the beauty of it is that it incorporates their traditional medicine and understanding of what they've been practicing themselves.
So it's a wonderful thing that they're not being told they did everything wrong and that you have to start over, and here we've got all the answers. Not that you would be that way, but I'm just saying that's been traditionally modern medicine versus traditional. That's a nice way to incorporate both and say, well, let's do this this together.
Right. There's a familiarity and comfort that's involved there as well.
So your funding is partly U.S. based. You get private funding from fundraisers, but you also get some assistance from the Guatemalan government. Tell me about that.
And the assistance that we get from the Guatemalan government, for example, our community health care worker program, which is actually the first community health care worker program that's naturopathically based in the entire world. We're the first to do it. And the Ministry of Health was kind of very excited about this type of community health care worker program. They exist all over in India, in Africa, in the Caribbean, but nothing with this kind of focus. So they were very interested in helping us and have helped us really subsidize our community health care worker project so that our community health care workers are actually certified by the Ministry of Health.
Huh. What's your long-term goal at this point? Would you like to open numerous more clinics or have more staff members to do some of these home visits?
Yeah. Our main goal is when we first entered Guatemala, we didn't come in just haphazardly. We decided to do a needs assessment. And so we went in and we did focus groups with the women from 17 villages, actually. And that gave us an opportunity to really to know what they wanted. And really what they wanted was cost-effective, sustainable medicine. The medical missions that we were doing with our medical students were great, but we needed something that was going to sustain itself when we decided to leave. So that's what our goal is really looking at sustainable means of how do we create healthcare and how do we create doctors from that region. So those are our long-term goals, so that it's a sustainable project, something that will be there long after we've gone to another country.
Absolutely. It can't be easy, though, to see some of these cases that are so difficult and sad, and to know the pain that they must have been suffering for so long. How does that impact you as a volunteer?
It makes you appreciate what you have, what we have in the States, but also you realize how resilient these people are, and the spirit of the camaraderie that they all share, how they care for each other. And the beauty of this program is that it allows their locals and their children to learn the medicine and practice it within their own communities. A lot of the times when you have heroes coming flying in, once the work is done, they fly away, and what's left, there's really nothing to continue. But this program allows that, the longevity of the practice and medical care to remain within their communities.
Some of these ancient cultures, at least what little bit I ever learned in high school and college, it reminds me that they had sort of the medicine man or the expert in the town or the village that people would go to. How did these people in their village get away from that or not have access to that over time? Is it just a sort of a lost art as people passed away?
Well, it's actually something similar that's happened here. I mean, the naturopathic physician of today in the United States and Canada was the original doctor before the advent of pharmaceuticals here in the United States. So slowly, when they were moving away from this system, there's still this kind of parallel system that exists in Guatemala and many countries where traditional medicine and conventional medicine are running side by side. So what is happening on one level is that the people want to hold on to the knowledge that they have, so they need someone to impart that to. And on the other side, you know, when you're sick, you need an antibiotic, and that's, so there's always this battle in a sense of you know, which medicine do you use and how do you use it, but at least when the environment that we're working in, that's the first line of defense for people. They've gone there first. And what I think we bring to them as well is we are trained through medical schools here. So we're not only utilizing natural medicine, but we're also using the standard diagnostic techniques that any other doctor would use.
But do some of their villages still have sort of a medicine man or a person
There's always
they do
a medicine
continue
man,
to go to?
always a medicine man. And actually one of the people that works with us is a traditional Mayan woman, and our medical students come down and we send them on a tour, on a class, so they can get to see how these herbs actually work. And we find out most of the time they're the same things that you could use in New York City, but they're using them there in Guatemala.
And they don't need a prescription.
And they don't need a prescription.
They don't have to wait in line over at the local Rite Aid.
Exactly.
Okay. No offense to my friends at Rite Aid. So we're looking at more video here. What's the most exciting part of this for you, Doctor?
Well, you know, I think it's every single day is a challenge. And there are some things, we always call it the Guatemala factor, things that we want to do, and sometimes they just never happen. And our challenge is really kind of working past that and making, trying to make things happen. Every day is something new. People come in with new stories. Some are very sad stories, babies that are dying, older women who are malnourished, and so they, just really don't make it. So those are the hard stories, but the good stories are when we're able to help someone that would never have been able to been helped. And medicine and access to medicine is a severe problem there. So what we're able to do is we're also able to give, through donations, medicine free.
Wow.
And this allows us to continue treatment for people who would say, all right, I have the medicine, but I can't afford to go to the pharmacy, so I'm going to stop taking the medicine.
Right.
So.
Well, it must be heartening to have one of those positives, even for a few that didn't turn out. It would carry you through, if you will.
Yes.
Dr. Carlos Cunningham, thank you so much, as well as Jeanette Hur.
us.
We appreciate both of you being here today to tell us about your work.
Thank you very much.
Thank you. That's New Jersey Perspective for this week. I'm Monica Melpass. Thank you so much for joining us. Have a terrific day.